Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Now let's look into the factors affecting the potassium distribution, and this is between the ECF and the ICF concentration. So to begin with, the shift of potassium into the cell. So potassium into cell. Potassium into cell, what happens is there is decrease in the ECF potassium. So decrease in the ECF potassium. So the examples here, it includes the insulin, the aldosterone, the metabolic alkalosis, as well as the diarrhea. Next, we will look at the shift of potassium outside the cell. Shift of potassium outside cell. So what does this include? This includes the insulin deficiency, aldosterone deficiency, hypertonicity, that is the hyperglycemia. Next is the presence of the beta blockers, cell lysis, that is it can include the intravascular hemolysis, as well as the tumor lysis syndrome, rhabdomyolysis, and the strenuous exercise. To learn and grow daily like this, please do subscribe.